Hello, my name is Elizabeth Montero, and I'm a Doctor of Nursing Practice student at the University of Massachusetts Dartmouth. This presentation is to discuss my scholarly project, which involved implementing a palliative care screening tool in an intensive care unit. Background. There has been a rapid growth in the elderly population. It's estimated that there will be 1.5 billion people aged 65 or older by the year 2050. There's an increased demand for critical care utilization in the aging population, and critical care admission at end of life is on the rise. Approximately 1 in 5 people die in the ICU. Studies have found that dying ICU patients experience significant distress that contribute to reduced quality of life. Palliative care, as defined by the Agency for Healthcare Research and Quality, is care that provides relief from pain and other symptoms, supports quality of life, and is focused on patients with serious advanced illness and their families. Palliative care is highly beneficial in the ICU setting and promotes comprehensive, patient-specific care. The purpose of this quality improvement project was to implement the use of the Gold Standards Framework proactive indication guidance tool during daily rounding in the ICU for 1 month. Findings of this study had shown statistically significant increase in the number of palliative care consultations placed and a decrease from ICU admission to palliative care consultation in the intervention group compared to the pre-intervention group. Furthermore, there was a 193% increase in palliative care consultations in the intervention group compared to the pre-intervention group. The majority of consultations in the intervention group were placed on day 1 in less than 24 hours. Qualitative surveys. Overall, survey respondents reported positive feedback on the use of the tool. 100% of respondents reported that the tool was useful in identifying patients for palliative care consultation. 17% of respondents reported that a pop-up in Epic may be helpful. However, it could be dismissed by staff and may contribute to pop-up burnout. However, 23% of respondents answered that the tool should be integrated as a pop-up in Epic so that the off shifts would have the opportunity to place palliative care consultations. Respondents commented that the tool carried real-world utility in addition to being easy, effective, and rapid. Recommendations. Specific criteria should be developed for the Improving Palliative Care in the ICU framework as developed by the Center to Advance Palliative Care. This would provide site-specific screening criteria and promote development among key stakeholders. Additionally, it's important that ICU providers and nurses initiate goals of care discussions early in ICU admission, as these are common reasons for palliative care consultation, and nurse knowledge and comfort surrounding goals of care discussions should be assessed and addressed. It may be beneficial to initiate palliative care in other areas of the hospital in order that goals of care be established to promote even earlier identification and to potentially reduce ICU usage at end of life. It would be useful to identify the effects of early and increased use of palliative care on patient and family satisfaction, in addition to cost and other quality of care indicators. I would like to acknowledge the D&P committee from UMD for their assistance and support in this project. Furthermore, the help of my site mentor was instrumental in guiding me at all phases of this project. Additionally, the palliative care nurse practitioner at my site has provided valuable support in not only this project, but also in his continued and wise advice as I enter a new phase in my career. I would also like to acknowledge the medical director of critical care at the site for his full support of this project. I'd like to thank the staff and my fellow colleagues at the site who participated and supported me not only in this project, but throughout my time at the D&P program. I'd like to acknowledge my beloved dog, Ollie, who deserves an honorary doctorate. I want to thank my family and friends, and especially my husband, for his endless patience, understanding, and support in my academic endeavors.